2020 was a challenging year for everyone and highlighted just how important Metro Charity and the services we provide are. We've been agile in our response to COVID-19 and will continue to adapt as we emerge from this pandemic, continuing to provide vital support and services to the communities we serve and are rooted in. You're going to see some of the highlights from 2020 demonstrating the diverse range of activities and services Metro delivers and the impact we have made. Our vision is for a world where diversity is celebrated, difference respected and valued, and where optimum health and well-being for all is a collective goal. In order to achieve this vision, we are informed by our 4 core values: innovation, insight, integrity, and investment. We provide services across the southeast of England: Essex, Kent, Medway, East Sussex, West Sussex and Surrey, as well as pan-London services. We also have a number of borough-specific services focused around South London. None of this would be possible without the hard work and dedication of our team. We have 107 staff and 85 volunteers who all work tirelessly to deliver our vital services. Metro continues to provide more services than ever before. Over the course of the year, we have delivered over 103,000 occasions of service, all across our 5 domains: sexual and reproductive health, community, mental health and wellbeing, youth, and HIV. Across all of our domains this year, we have worked innovatively to continue to deliver services, hold activities and events, and promote health and well-being. We are going to see a snapshot of some of these key activities and events from January to December 2020.
That from now things can change.
Hey, happy Pride!
Happy Pride, everybody!
Happy Pride, everyone!
We are launching a campaign today, Pride First, to gather all the histories that people have in the UK and beyond of your Pride Firsts.
Hello all my divas at the Metro LGBTQ youth group.
You've seen some of the highlights from across our delivery domains last year. And as we continue to move forward, we have priorities for the year ahead for each domain.
In the sexual and reproductive health domain, our priorities for the year ahead are to explore innovative ways of delivering SRH services in a post-COVID world, and accordingly to offer a blended array of options for service access, including face-to-face, community outreach, online, telephone, social media, and virtual platforms. We also want to develop and secure sources of independent and non-statutory funding, in particular by developing training and resources which capitalize on our unique knowledge base and expertise. Finally, we want to support staff within the domain to develop skills around effective service evaluation and co-production, so that we can ensure services developed within our domain are strategically influenced by both service users and outcomes in a planned, iterative way.
In the community domain, our priorities for the year ahead are to develop Metro GAD, so that its work around the voice of disabled people continues to be enhanced. We want to support community development to build resilience in communities in light of COVID-19 and equalities disparities it exposes. We also want to enhance our capacity building support and grant making support so that it helps to build capacity and resilience within our small and BAME-led groups.
In the mental health and wellbeing domain, our priorities for the year ahead are to integrate a mental health awareness approach into all the programs across the charity. We want to work pan-metro to address social isolation and the impact of COVID-19 on mental health, and look at how COVID-19 has affected both our clients, our staff, and our volunteers. We want to expand our programs in the mental health domain to reach more communities who struggle or are vulnerable in some ways, particularly communities of Black, Asian, and minority ethnic people, and LGBTQ+ people.
In the youth domain, our priorities for the year ahead are to increase youth engagement and decision making and service design across the domain, and to implement a blended online and physical space delivery model in line with young people's needs.
Within the HIV domain, our priorities for the year ahead are firstly to keep on supporting people living with HIV. We'll do this by providing support for programs which help people with practical issues, such as how to access the welfare benefits system, support with housing and debt management, employment and education support. We also want to work to engage service users on a new programme which focuses on tackling HIV self-stigma and is funded by the London HIV Fast Track Cities campaigns. We also want to work to diversify our HIV prevention offer in light of COVID-19, including access to online STI and HIV testing, supporting people around access to PrEP, and continued support for people living with HIV to keep on taking their treatment and live well with HIV.
You've heard the priorities for the year ahead from each of our delivery domains. We also have priorities across our core areas: communications policy and research, fundraising, HR and volunteering, governance, and finance and premises. Metro continues to grow, with our income increasing year on year. Projected income of over $5 million for the financial year end 2021. Our expenditure across our 5 domains remained relatively consistent, but with growth in our community domain, as we completed our merger with Greenwich Association for Disabled People, now Metro GAD, and the launch of our Connecting Communities Alliance partnership. In total, our expenditure was less than our income, which resulted in a surplus of £23,404. This aligns with our trustees' plan to continue to maintain reserves of 3 to 6 months of operating expenditure. We cannot deliver our vital work without our individual and corporate supporters, funders, and commissioners Your money and support is invested directly in activity that makes a positive and lasting difference to the lives of the people we work with. To maximise your investment, we continue to keep our costs very low.